Uh, about 65% of women and girls in Kasese district, western Uganda, cannot afford sanitary pads. Evidence suggests that the period around puberty is one in which many girls drop out of school or are absent from school for significant periods of time. This means that over 50,000 girls miss 6 weeks out of school every year, and women miss valuable work hours. Menstruation can cause the district girls to lose an average of 3.5 learning days per month. That is according to Muvia 2011. Limited access to safe, affordable, convenient, and cultural appropriate methods for dealing with menstruation has far-reaching implications for rights and physical, social, and mental well-being of many adolescent girls in the district. It undermines sexual, reproductive health and well-being, and has been shown to restrict access to education. Faced with the complete lack of sanitary pads, this can only mean that the girls miss for considerable periods of time, and this has negative impacts on the quality of learning they receive. Their overall academic performance, their retention, and transition through the education system. Meanwhile, UNESCO estimates that 1 in 10 African adolescent girls miss school during menstruation and eventually drop out of school because of menstruation related issues. Furthermore, many adolescent girls and women in the district in particular have limited knowledge about their bodies, especially in relation to menstruation and sexual and reproductive health. Menstruation is treated with silence as a taboo topic, with menstrual blood viewed as unclean and harmful, which limits women and adolescent girls to access relevant and important information about their bodies. In schools, there is usually a lack of physiological education. This is often attributed to predominantly male sex teachers feeling uncomfortable about teaching such subjects, especially if they have not received formal training on how to do so. At home, advice, that is to say, traditionally given by aunts and grandmothers, is often insufficient. Older women are often considered wise, and also they are illiterate and may not recount and reinforce myths that are biologically incorrect. Uh, our solution is using an appropriate way to help girls deal with their menstrual periods through reusable sanitary napkins. The vision of this project is to ensure empowered girls and women are in charge of their own socio-economic development. The project provides health information and free sanitary pads to primary school girls from less privileged backgrounds that have reached puberty and cannot afford it. Some young girls from less privileged homes are exposed to all kinds of sexual activities. They have no knowledge of health issues and the effect on them. Their project also promotes the social marketing and distribution of reusable sanitary pads that are developed and made locally and meet required quality and safety standards to marginalized girls in selected poor and marginalized communities. The promotion and distribution of the reusable pads has been an entry point for the promotion of a wider action only on menstrual and reproductive health rights. Uh, I am Masereka Kikumba Godfrey, and I am a social worker who holds a bachelor's of social work and social administration. Uh, I am a co-founder of this initiative, which basically aims at providing information about menstruation and reproductive health rights to societies, such that young girls are able to take charge of their menstrual periods.
Wow.